Hi everyone, a very warm welcome to the University of Queensland's Doctor of Medicine webinar. My name is Irene Hui. I'm the International Manager of the Faculty of Medicine here at UQ. It is so great to see so many of you tuning in tonight. And today we have like 3 speakers on our panel. And we have Professor Stuart Carney, Dean of the University of Queensland's Medical School. We have Kelly Cox, who is the coordinator at our faculty admissions team, and also Jonathan Ogot, who is our Year 3 medical student. So welcome. And before we start, let me just share the screen. So before we start, on behalf of UQ, I would like to acknowledge the traditional owners and their custodianships of the lands on which we meet this afternoon. We pay our respects to their ancestors and their descendants who continue cultural and spiritual connections to country. We recognize their valuable contributions to Australian and global society. Also, we would like to express our firm and proactive commitment to supporting efforts for greater diversity and inclusion within our university. And now I'm very pleased to introduce our first speaker, Professor Stuart Carney, who is the Dean of the UQ Medical School. Professor Carney, please.
Thank you very much. I'm just going to take control of the screen myself. Excellent. And can you now see my slides?
Yep, it looks
Excellent.
great.
Thank you very much, Irene, and a very warm welcome to all of the prospective students, family and supporters who are joining us today. As Irene said, my name is Stuart Carney. I'm the Dean of the Medical School at the University of Queensland, and I too acknowledge the traditional owners of the lands upon which we meet. Now, as Dean of the University of Queensland Medical School, I'm proud to be in this sort of fabulous building, which is now displayed on your screen. Now, this is a sort of a wonderful building that has been home to the medical school, and in particular the medical school administration, for our rich 87-year history. You'll notice above the main entrance a very bold statement. I understand that you as prospective students have choices, that there are great medical schools around the world, that I've had the pleasure of visiting great medical schools, NUS in Singapore, Chinese University of Hong Kong, Hong Kong University. I previously was the Dean of King's College, London Medical School, or otherwise known as Guy's, King's and St. Thomas's. Here in Australia, there are also many great medical schools for you to choose from. James Cook, Deakin, Melbourne, Sydney. But as you'll see from the building where my office proudly sits, there's only one medical school in the world that claims to be the medical school, and that is the University of Queensland Medical School. Joking aside, as I say, there are sort of, you're in a privileged position with plenty of choice. And I'm going to tell you a little bit more about the University of Queensland Medical School to help you make a more informed choice around what might be a better fit for you. We, as the University of Queensland, are proudly based in and around Brisbane. As a university, we are a public university, a comprehensive university, which means that we offer programs across the full range, from music through to engineering, from IT through to modern languages and medicine. We are a university founded by the people and very proudly, not just an international university with a proud international reputation, but the university for Queensland. And one of the ways in which we demonstrate our commitment to the people of Queensland is not just through the research and the education that we offer here in Brisbane, but also through the work of our Royal Clinical School, recognizing that, like many of the countries you come from, Australia is a distributed country and that we need to address the workforce challenges and needs of those individuals who live many hundreds, if not thousands of kilometers from our capital or major cities. For over 10 years, we've also had a proud relationship with a US healthcare partner called Ocean Health, and also have a clinical school in New Orleans, which extends beyond New Orleans now to the states of Louisiana and Georgia. So truly a university with a very proud history, yes, here in Brisbane, with a significant reach into regional and rural Queensland, but also an internationally connected university with a campus in New Orleans. So I'm going to speak more broadly before I get into some of the specifics about our medical program here at the University of Queensland, and talk about some of the challenges that we're facing within healthcare. Now, I'm a psychiatrist and trained as a psychiatric epidemiologist. Now, epidemiologists are interested in the study of the distribution and determinants of disease. And if I was going to give this introductory talk and talk about the some of the major factors that are likely to influence your career over the next 30, 40, 50 years of your medical careers, I probably 3 or 4 years ago would have spoken first and foremost around aging and non-communicable diseases. I'll come to them in a moment, but I think we all recognize that perhaps we had become a little complacent, that significant advances in antimicrobials, for example, had led us to believe that communicable diseases no longer presented a major threat. This university has been at the forefront of dealing with communicable diseases, such as the challenges associated with HPV. And Ian Fraser, for example, one of the scientists who developed the Gardasil vaccine based here at the University of Queensland. And advances such as vaccines, advances such as antibiotics and antiviral agents and other public health initiatives, I think until about 3 or 4 years ago, resulted in us being a little bit complacent. But our world for the last 3 years has been turned upside down, and it's been turned upside down because of COVID-19. So I think as we we look forward to the next 30, 40, 50 years and some of the issues that you will be grappling with, I think we cannot forget, must not forget the particular challenges around communicable diseases and responsibility, the need for us to ensure that, amongst other things, that we continue to push the boundaries as far as vaccines are concerned, that we continue with the major public health work that we've been engaged in over the last 3 years, and also that we don't sleepwalk into some major challenges that are beginning to be talked about in major journals such as Nature and The Lancet, particularly around antimicrobial stewardship and the inappropriate use of antibiotics. And if we don't discover new antibiotics and we don't control our current use of antibiotics, things that we take for granted today, such as hip replacements, may become increasingly challenging going forward. But of course, one of the things that COVID did bring into sharp relief, yes, it is a communicable disease. It also highlighted significant inequities within our society. And one of the most vulnerable groups within our society are those who are aging. Now, older adults make a significant contribution to our society. They are our wise parents, our wise mentors. They are the individuals who play a significant role caring for members of our family. They're also amongst the greater users of the healthcare system. So as our population ages, the demand for healthcare grows. With aging, we become frailer. With aging, we acquire more non-communicable diseases, chronic conditions such as diabetes, such as heart disease, recurrent conditions such as depression. And these conditions result in greater utilization, greater need for healthcare systems. So thanks to the major medical and public health advances of the last 100 years, we as a population are living longer. And that means that we who work within the healthcare sector have to become smarter at the way in which we provide care. That whilst the population over the age of 65, 75, 85 continues to grow, the number of individuals potentially available to contribute directly to the workforce is plateauing and also in some areas in decline. So this will mean that the future of healthcare that you will be shaping will need to change. We will need to embrace new technologies. We will need to be smarter about the way in which we support our aging populations and also those who are living with chronic conditions. Now, chronic conditions are not just the preserve of those individuals who are more advanced in years. 1 in 2 Australians overall have a chronic condition. Whilst, yes, they're more common with advancing years, they're also significantly present in all of us. And as this great slide from highlights, around a third of those could be prevented. So I think that the doctor of today and the doctor of tomorrow needs to play a key role in working with their patients, working with our patients to try and address some of those modifiable risk factors to ensure that we can prevent the rapid increase in chronic conditions. So that takes us to sort of what we're doing here at the University of Queensland. And I think I have probably one of the best jobs in the world. I get to come to work every day, work with bright students, bright colleagues, professional staff, academic staff, clinicians, researchers, teachers, pushing back the boundaries of knowledge. Thanks to the questions you ask in your classroom, you give us a new perspective on things. And as a consequence of the innovation of the colleagues with whom I work, we are sort of pushing back the boundaries of knowledge. And here is a wonderful picture of Michael Wiggles, an orthopedic surgeon, one of our colleagues, who developed, used 3D printing to sort of transplant the first fibula and tibia in an individual who had been involved in an accident. So things that sort of were the subject of science fiction, perhaps when I was through medical school, are now sort of part of the reality of the healthcare environment that you will be sort of entering as you train and graduate. Now, across healthcare, and I've already hinted at this, we need to embrace new technology, and we are embracing 3D printing, electronic medical records, telemetry, wearable devices, artificial intelligence, and these are great innovations. And I was at a workforce summit today where it is estimated that in the next decade, around 20 to 30% of the tasks that we as healthcare professionals currently engage in might be replaced by some form of technology. Now, we haven't been that good at implementing technology more broadly in health. All other sectors have really eclipsed us. In fact, sort of some of the early sort of data around embracing technology such as electronic medical record, certainly in the United States, have been associated with reduced productivity and increased burnout. But yes, I think the future is rosier, and I think many of the technologies that are sort of on the horizon are poised to help revolutionize the way in which we provide healthcare and essentially free us up from many of the tasks that sort of add little value to our day-to-day practice. As doctors, as healthcare professionals, we are social beings. And I think we as healthcare professionals bring to the table those interpersonal capabilities and skills. So the conversations that I've been part of at governmental level, at college level, at hospital and health service level here in Queensland, in Australia and around the world are that we are facing an enormous shortage of healthcare workforce, an enormous shortage of doctors. You are an important commodity. And I think there will continue to be a critical role for us in the provision of healthcare, bridging the gap between technology and the patient, being the person who works with the patient to synthesize a lot of complex information and formulate a management plan. And that relationship, those relationships do bring significant joy, the sorts of joy you get when you discover that you just passed your year 3 or year 4 exams. And I'm sure Jonathan will talk about year 3 in a moment. So in that context, we as a university, mindful of our social contract, mindful of our responsibility, mindful of the changing world in which we are operating, mindful of the advances that artificial intelligence might bring, but recognizing that first and foremost, we are about people, and those people are aging, those people are living with chronic conditions. Those individuals are much better informed than perhaps they were historically around their healthcare needs, that we need to equip you with the skills you need to be the leaders of the future, to be the individuals who push back the boundaries. So we're in the process of rolling out our new program, which builds on the great program that Jonathan is part of. And this is and will continue to be a 4-year graduate program organized around sort of 4 year-long courses with an assessment program that really recognizes that we need to draw upon information from a range of different aspects, not just what you know, but what you do in the clinical environment and the type of person you are as you continue to grow in confidence and competence as a partner and team player, as a kind and compassionate professional. But in this context, recognizing the importance of transitions, the transition to medical school, the transition to the more clinically sort of immersed parts of our program, and the transition from medical school through to your internship. And that program is now sort of progressively being rolled out, and we welcome this year the first intake into year 1 of the new program, who are undertaking a year-long course, which enables people to learn at their own pace. But as a medical school, as a research-intensive university, as a comprehensive university, we also provide opportunities for you to sort of test various sort of career pathways. All of us as healthcare professionals, all of us as doctors need to be research literate. All of us need to be curious, to ask the awkward questions, and to have the skills, the capabilities to be able to critically appraise that wealth of information, that wealth of data, healthcare sort of information, which is doubling every 73 days. So all of us need to be able to curate that knowledge, to ask the questions and critically appraise the data. But some of us may choose to go one step further and to be research collaborators or even research leaders. And we have opportunities for you to test whether research is and should be part of your sort of professional experience, and various sort of opportunities from summer research programs to extracurricular research. And for those who want to take it one step further and do an MD, PhD or an MD, MPhil, a clinician research track. There are, of course, also opportunities for you to do PhDs after you qualify as well. That there's no best time for doing this, but we do have a number of students who seek to do a PhD concurrent with their medical program. And mindful, as I've said, that at its heart, medicine is about people. We recognize the importance of supporting you, our future colleagues, supporting you as students. And we have a range of resources to enable you to transition into the medical program and to grow in confidence and competence as a healthcare professional. Also recognizing that the medical program is a tough degree, and we want to sort of to ensure that you can flourish and thrive. So amongst the resources that are available to you are the medical school student support team, as well as our personal advisor network, individuals who will walk with you for the duration of your medical program. And I think also sort of recognizing the importance of being connected, of relationships, of your peers, the UQ Medical Student Society. And I'm sure Jonathan will talk more about some of the wonderful opportunities that our students sort of make available. Now, in a couple of weeks' time, there'll be the May Ball, which I think 4 years ago was on May the 4th, which is why everybody's dressed up as Star Wars characters. But there are a range of other sort of social events which enable our community to come together to sort of celebrate that sort of network, that team, that community, which is the bedrock of our future practice. So fast forwarding 4 years, what happens to our students? the majority of our students choose to ultimately work in the Australian healthcare system. Some of our students choose to return home, but the majority of our students, be it for love of Australia or love of somebody in Australia, choose to stay here. And at least, and as I've said, over the last sort of 5 years, 86% of those who have graduated from our program who've come from overseas have chosen to stay here, at least for the initial stages of their postgraduate training. And where do they go? Well, those who stay in Australia, the majority of them will stay with us here in Brisbane or in Queensland. But we also have a significant proportion of students who come from Canada, and they have matched residency pathways across all of Canada, across all major specialties. And I suppose the next biggest group will be our Singaporean students who have matched to internships in the Singaporean healthcare system as well. But as I said, 86% at the point of graduation go on to work with us here in the Australian healthcare system, and our healthcare system values you for that and is very much enriched by the different perspectives that our diverse medical program brings. So I have one question for you. I have outlined some of the major challenges that we are facing as a healthcare system. I don't think my generation of deans of healthcare professionals have answered all of those questions. We're looking to you to really push back the boundaries of knowledge. Healthcare is and will always be fundamentally a human endeavor. It is built on relationships, but there are plenty of opportunities for you to push back the boundaries of knowledge. So I ask a simple question at events such as this, and that is, do you want to make a difference? And if the answer to that question is yes, then perhaps you should consider joining us at the University of Queensland. Thank you very much. I'll now hand back to Irene.
Yeah. So thank you very much, Professor Carney, for giving us such a good overview of the MD program and also the current trends in health and medicine. Our program does offer a wide range of learning, research, and social opportunities. So coming up next, our second speaker is Jonathan Ogot. He's our Year 3 medical student, originally from Singapore. Jonathan, you will be sharing with us your UQ journey as an international medical student. Take it away.
Okay, let me try. Yep. Sorry, I was trying to share. Can you see the screen? No, not yet.
Not yet.
Okay. Okay. Try now. Yep. Can you see it now?
Yes.
Okay. Sorry. And yeah. So my journey to medicine. So as Irene said, I'm from Singapore. So I graduated from the Republic Polytechnic in Singapore back in 2016, then went to complete my national service and work in the emergency field for a year after that. So I decided to come back to university in 2019 and graduated that year as well. Then I did a year of honors, and then I got into medicine in 2021. So now I'm my third year currently at Ipswich Hospital. So my motivations for wanting to pursue medicine is previously I had experience in the medical field, EMT, and I really enjoyed my time serving the community in that aspect. And I realized I prefer having a clinical setting over research. During biomed, I did a lot of research, and I realized I like the human interaction, understanding the medicine, and getting to treat people. And I also was greatly motivated by a lot of familial illnesses in my family. And I wanted to be more knowledgeable in the field and really understand what was going on, and seeing how doctors treated my family, and they treated them really well. And I wanted to be a part of that for someone else's family. And I knew that this was something that would require a lot of hard work, but I understood that this is something that is a blessing for other people. So why Australia? I really like the vibe. It's very relaxing, very peaceful. It's very chill compared to Singapore, where everything felt like a rat race. And coming down to Australia, everyone's really nice, everyone's really friendly. They actually smile at you when you look at them, not like back home where they just look away or think that you're something's wrong with you. But yeah, and I honestly love the nature in Australia. There's so much to do. I remember first week in Australia, I went to the beach almost every day after going to the wildlife sanctuaries. And honestly, the food here is really good, especially the fish and chips. So why UQ? So UQ was the only university degree in Queensland that was recognized by Singapore. So I wanted that option that even if I wanted to go back to Singapore to work as a doctor, I knew that with my degree it was allowed and it was recognized. And also Brisbane, since I was already in Brisbane, I felt like I didn't explore Queensland enough, and I really found it very interesting. I mean, I've been to Sydney, I've been to Melbourne. However, I felt Brisbane was more of my speed, and I really liked the area and the people. And also UQ is also one of the most top ranking universities in the world. Last I checked, it was top 50. Yep, and the third in Australia. So I think it's really good, not only in research wise, but also we have really good clinicians to teach us here. So for UQ lecturers, like we typically get clinicians themselves that take time off work to teach us. And I think having that clinical aspect really helped in solidifying and bridging the gap between theory and the clinical setting. So what's the day in the life? So currently I'm in my surgical rotation. So we have to, I wake up at 5:30. So I wake up earlier than most because I have to travel out to Ipswich, but honestly, experience is worth it because ward round starts at 7. So this gives me time to like maybe get a coffee, read up on notes before ward round actually starts. And then typically surgery ward rounds go a bit fast because they have to prep for either surgery or clinics. So for surgeries, you get to assist some surgeons in your case. So like if it's a lap chole, a laparoscopic cholecystectomy, where you remove a gallbladder with a camera, you get to assist in holding the camera, and it really like gets you in the mood and makes you really feel like you're making a difference. For clinic-wise, they let students actually see some patients, makes you understand how it feels like to be a doctor in that setting or a doctor in training. And then you discuss with your consultant or your registrar on how to proceed with the case. Sometimes you have to make a plan, bring it to the doctor in charge, and so this is my plan, this is what I want to do with the patients, and they'll guide you along whether you're doing it right, you're doing it wrong, and they'll drop some teachings along the way. Then in the afternoon, you have surgeries, clinic, or you also have tutorials. So our tutorials are run at Ipswich Hospital by some registrars. We actually are very fortunate to have consultants coming in and giving us tutorials on specific systems that they're interested in or they're good in. So we have a colorectal tutorial coming up soon on Thursday. We had a breast tutorial last Thursday as well. And after that, typically the day ends around 4, can be earlier, can be later. And by that time, it's free and easy. You can go home, relax, go to the gym, get some food, and then the day starts again. So yeah, but in first and second year, it's a bit different. I don't have a slide for that, but in first and second year, it's mostly lectures in the morning. Then you might have CBL, where you come in a group of with your group of classmates to discuss a case, talk about a case, discuss it. We have a tutor that will guide us along. But typically, we try to run it as a group first before the tutor has to step in and show us like where we're wrong, where we're lacking. But at the end of the day, medicine is just how much you want to study, and they will try not to force feed you. But I feel like there's so much things that you can learn about, and it's so interesting. And you have so much friends that want to learn with you, and you honestly feel like time flies, and you'll get to third year, fourth year in no time. So student support, as Professor Stuart Carney said, there's UKMS, which is student run. So they fight for, they are the voice for the medical students, and they work together with the faculty to make sure that everything's running smoothly, and they plan programs. And like as Professor Stuart Carney said, there's May Ball, there's other events such as like kegs, post-exam events. We also have the UQ Medical Student Support Team. So they typically, they have an office in St. Lucia where you can visit, but they also visit different hospitals. I think either bi-weekly or once a month, and they will come down and actually like chat with you on like how you're doing. And we have other medical student societies such as UQ Mind, Rainbow Crit, UQ Crit, and like Rainbow Med, where you will find like people, like friends and students of like-minded that will support you, and whatever interest that you have, you can join in. Everyone's really friendly, and yeah, you can really jump in and have all the support you need. But don't forget that you have friends and family along the way, and rely on them. So social activities. So as I said, Queensland is a beautiful place. The photo on the left, you can see like we went hiking to some mountains in Noosa. One of the in the photo in the middle is like keg. So it's one of the events that's run by UKMS after the exams, where med students get together and de-stress over like soft drinks, because you know we're health conscious. And yeah, so and there's also like a lot of good coffee places in Australia, where this place is Bunker in Milton, which serves really good coffee. Actually, around Australia, you have really good coffee, which is amazing. And so these are other social events. So as I was saying, there are other student societies. So this is one of the student society, UQ Singapore Society for medical students, and you can get along and find other student societies as well. And this is photos from the May Ball with my CBLs. So my first and second year CBLs, and honestly, it's a great time getting to know your friend outside of the hospital, outside of school. And yeah, that's about it. Thank you for listening.
Wow. So thank you, Jonathan. Thank you for your sharing. And I also agree food and coffee are very important, especially for medical students. And for me, I mean, it is so great to see how much you have grown here since you're joining UQ and since we have met you at the medical school. So really impressive. And I'm sure a lot of you are very keen to find out more about the application process and the entry requirements of our program. So I will pass it on to Kelly Cox from our faculty admissions team, and she will walk you through the process. Kelly, please.
Thanks, Irene. I'll just share my screen. I'm assuming you can see the PowerPoint now. Is that correct? Yep. Okay, so welcome everyone. It's really wonderful to have you here. As Irene said, my name is Kelly Cox and I am the coordinator of admissions within the Faculty of Medicine. So I'm just going to try and run you through a few of the steps to applying for our wonderful MD program. So we actually have two entry points. One is for provisional entry for Year 12 students, and the other one is graduate entry for existing students who are either they've already graduated from a bachelor degree, or they're in their current they're currently in their final year. Okay, so I'll just quickly go through some of the provisional entry aspects of entry into the MD program. So it's a 7-year program because the MD itself is a postgraduate program. So those are entering for provisional entry from school. You still need to do your undergraduate degree first, but you can do it as one package deal here at UQ by taking this pathway. So you must apply in your final year of high school. So whether it's Australian, Year 12, IB, A levels. And when you apply, you don't need to tell us what you want to do for your undergraduate degree. Once you get an offer, we'll actually contact you and ask you what you would like to do. You just need to make sure that you are also eligible for whatever you would like to do for your undergraduate degree, whether it's a Bachelor of Biomedical Sciences or a Bachelor of Dentistry. Okay, some of the academic requirements includes an ATAR, which is the Australian tertiary admissions rank of 95. So an equivalent could be an IB of 37, or UK A levels might be 14 of the best 3 A level subjects that you are doing. You can always contact our international admissions team and they'll be able to help you if you're not quite sure of your equivalent. You need to complete an English subject prerequisite in Year 12, and you need to, very importantly, undertake the UCAT ANZ, which is the admissions test for our provisional entry medical students. This must be taken in the year of application, and there are a number of test locations that you can undertake this at. But please note, we used to take ISAT, which was a different kind of admissions test, but we're not accepting that anymore. So please take note of that. It must be the UCAT ANZ in the year of admission. Okay, there's also obviously English language requirements. So you actually need to meet the English language requirement for whichever undergraduate degree you would like to do. So as I said, the Doctor of Medicine is actually a postgrad program. So you actually need to meet the requirements for whatever you're going to do first in your undergrad. Most UQ programs have a minimum IELTS of 6.5 overall and 6 in all subcategories. Some bachelor degrees do require higher than the minimum, so please make sure you do your research. But we've got a lot of options for your undergraduate degree. There are also other ways to meet the English language requirement, such as completing high school or senior secondary school in a country where the medium of instruction is English. A very, very important part of both the provisional entry and the graduate entry application process is the completion of a multiple mini interview. So invitation for provisional entry students to the interview will be based on the UCAT ANZ total score. The interviews are held online, and after those interviews, applicants will be ranked in merit order based on ATAR, 25% of the ATAR, 25% of the UCAT ANZ, and 50% of the MMI score. Now, the 25% UCAT and 25% ATAR covers that academic aspect of it. The 50% of the MMI score covers the non-academic requirements that we're looking for. So these interviews are really going to assess personal qualities such as kindness and compassion, integrity, adaptability. So don't worry, you're not going to turn up to an interview and have us start quizzing you about how many chambers are in the heart. It really is non-academic aspects that are important for becoming a doctor. Okay, so fees, you obviously will have your undergraduate bachelor degree fees as well as your Doctor of Medicine fees. So it's an indicative annual fee last year was about $91,819 for the Doctor of Medicine. Actually, no, that's this year. That's this coming year, sorry. But you will have to incur the fees for both the undergraduate and the postgraduate. So keep those things in mind. The other really important aspect for provisional entry is that you will have some requirements to complete before you actually progress into the MD program. So you should keep these in mind when you're selecting which undergraduate degree you are going to do. You need to complete your undergraduate degree with a minimum GPA of 5. So it's always good to do something that you might enjoy, because it's a bit easier to get that good GPA if you're having fun as well. You need to complete the degree in the minimum amount of time required. So if you choose to do a degree that typically takes 3 years, you need to complete it in 3 years. And you also need to complete 2 MD subject prerequisites, so integrative cell and tissue biology, as well as systems physiology. UQ just happens to have 2 courses that have those exact titles, Biome 2011 and Biome 2012. So we also do have a website, and we might put that in the chat later on, that outlines the prerequisite requirements and also has some suggested undergraduate programs that you might like to take that include those subject prerequisites, either as a core subject or that you could take as an elective. So as long as you meet those entry requirements by the end of your undergraduate degree at UQ, then you should be able to progress into the MD program. So graduate entry students. So obviously you don't have to worry about your undergrad, you've already done it, or you're currently in your final year, and I'm sure you'll be very relieved of that. So then you'll go straight into the 4-year MD program. You can apply in your final year of your bachelor's degree or master's, or we also accept PhD, but you must have completed it within the last 10 years if it is already complete. Your degree can be from UQ or any accredited university recognised by UQ. Okay, so like provisional entry, you also have a admissions test that you need to complete. So you can take either the GAMSAT or the MCAT. Either is acceptable unless there is anyone here that's online from the United States and you're thinking about taking the OSHNA pathway, which we're not really talking about here, but if there is anyone who is thinking about that, who is a US citizen, please keep in mind that we only accept the MCAT for that pathway. But otherwise, everyone else, you can choose either the GAMSAT or the MCAT. GAMSAT, you need to achieve a 50 in each section. And you must have completed within the last 4 years, and the MCAT 504 obtained within the last 4 years. You need to have completed your undergraduate degree with a GPA of 5 on UQ's 7-point scale. And you need to have also completed those subject prerequisites. Now, obviously, if you've studied at a different university, you may not have, you won't have our particular courses, but we have a long list of approved prerequisite courses and even some programs that will meet those prerequisites on our website. So again, I'll try and put that in the chat so you can check that out. Okay, so graduate entry English language requirements. So you're coming straight into the MD program, so you will require an IELTS of 7 overall, with 7 in each of the subscores, or there's also some examples there of TOEFL and Pearson's as well, if you are doing if you need to do a different English language test. And like with provisional entry, there's also other ways to meet the English language requirements, such as completing Year 12 or your bachelor's degree or master's in a country that has a medium of instruction of English. Okay, again, multiple mini interview. They're not very scary. Actually, they're not scary at all. They're wonderful, and you'll get to be interviewed by some of our wonderful professional academics and some community members as well. They're really interested in making sure that we have the best doctors, and that really excited to see you join the program as well. So again, you will be assessed on personal qualities such as kindness and compassion, integrity, adaptability, verbal communication. For graduate entry, applicants are selected for interview based on 50% of their GPA and 50% of their MCAT. And then after the interviews are held, they'll be selected for offer based on 25% GPA, 25% either GAMSAT or MCAT, and 50% MMI. So again, the fee for the Doctor of Medicine is about $91,819. There are additional costs, so please be aware of that. So, you know, if you're driving back and forth to various places. You obviously have to pay for petrol yourself, living expenses, things like that, as well as other requirements such as first aid certificates, including CPR. Okay, so if you are made an offer, please be aware that we have these other things called work integrated learning requirements. So these are other requirements that you will also need to complete. So we have a website that has all of these listed, and I'll try and put that in the chat as well, just so that you can all have a look at it. But some examples of these requirements is that you need to have a first aid certificate. You need to apply for a blue card or yellow card. These are cards in Queensland that allow you to be able to work with children or the disabled. Also, you need to provide immunisation records. These are the other sort of things that you'll need to you'll be required to complete if you receive an offer. Some requirements do have very specific timeframes for completion, so please look at the website and just make sure you take note of those timelines, because some of them you might be able to start completing as soon as you get your offer, as soon as you enroll, and others you might have to wait until just before you start. So please look at the timelines on the website. And any information regarding these requirements are, yeah, they're on the website. I've said that multiple times. It's all right. Okay, so application deadlines, provisional entry. You need to submit your QTAC application, so that's the Queensland Tertiary Admissions Centre, by the 29th of September 2023. And the interview rounds, the interview round will be scheduled for November. For graduate entry, for round 1 of the interviews, you need to have applied by the 9th of June. And for the September interview round, you need to have applied by the 4th of August. Okay, if you do have any questions, because I did go through this fairly quickly, please feel free to email us at med.inquiries@uq.edu.au. I've got a wonderful team who is absolutely happy to help you in any way they possibly can. So we just want to make the process as easy as possible. All right, so that's all from me. Thank you, everyone. I'll stop sharing now.
Yep. So thank you so much, Kelly, for the very clear information. So we now have the time for the Q&A session. We have about 10 minutes for that. And feel free to type your question in the chat, and then we'll have a look at that. I have seen someone raising their hands, so feel free to type your questions in the chat, and then we will come to it one by one. While we are waiting for you to type your question, we do have received some questions beforehand. And so the first one we have here is there are a large number of very good medical schools in Australia. And what exactly makes UQ stand out? So I will direct these questions to Professor Stuart Carney. So in addition to we have the medical school building. So what else makes UQ really stand out from the others?
Thank you very much. I think that's a great question, and I sort of preface this as I said earlier that all medical schools in Australia are accredited by the Australian Medical Council, so all of them will enable you to be a valued and valuable member of the healthcare profession. So I suppose the question is sort of what might make UQ sort of that UQ is a better fit for you. So I'm biased, of course, and maybe others might want to speak as well, and we'll put Jonathan on the spot in a moment. But the University of Queensland is a global top 50 university, so we are proudly sort of pushing the boundaries in sort of 50 of the 53 sort of major domains that are typically reviewed by the Times Higher Education supplement and others. So sort of I get to work with academics who are really making a difference in everything from sort of Aboriginal and Torres Strait Islander languages through to sort of to human health, global environmental change, architecture, and the like. So it is truly a global, sort of a comprehensive university. We're a globally connected university, and as a medical program, we have a very strong partnership with the Australian healthcare system, which provides, I think, a unique opportunity for our students to be able to sort of to compare and contrast firsthand the healthcare system from their own country, from Australia, and in the United States, if they choose to sort of take advantage of a placement there as well. Given the sort of where our students come from, I think the greatest gift we give are the students we've assembled, and it is a diverse student population, and I think that helps us to be better doctors. It helps us to understand that the world in which we're operating is much more diverse than our experiences perhaps to date might have suggested. We're also about to launch we're in the process of launching a major medical sort of program reform, which I think is an exciting time to be part of a medical program and to sort of to benefit from the latest thinking in a medical curriculum and assessment. And also Brisbane, great city, as Jonathan said. It's a warmer place than perhaps sort of Sydney and Melbourne, the other sort of major cities that sort of people often sort of gravitate towards. But this is a wonderful time to be in Brisbane, or the Greater Brisbane area. In 2032, we'll be hosting the Olympics. So a huge amount of investment in sort of building an even better city. So transport links continue to sort of to develop. Sort of every block has yet more sort of cranes on it as new buildings are going up. So it's a great place to be in. I think the sort of the world's interest, the spotlight, thanks to the Olympics, is shining on this state and on this city. But I'm biased. Jonathan, is there anything you'd like to add?
I think you said most of it. Yeah, everything's going well for Brisbane, and yeah, I think UQ is good because I think we're situated in a very nice location by the river for the main campus, and we have a lot of hospitals around that are willing to take in medical students to teach around Queensland, not just within like local central Brisbane, but even outside of like Brisbane. There's so much places you can learn from. I think UQ is the place to be.
Yep. UQ is the place to be. So now let me have a look at the chat. So I can see two admissions questions. Maybe we go through that first. So Kelly, so there are two admissions questions. So the first one is about a student from studying foundation program, and then we have another one about international students studying IB. So would you like to take them?
Absolutely. Thank you very much, Irene. Transfers from other universities directly into the MD program is not a common pathway. It usually requires extreme exceptional circumstances. So unfortunately, it's best off just to apply through the usual process. In terms of whether someone from overseas doing IB can apply for provisional entry, absolutely you can. So we'd be excited to have you. It's the same as the slides I was sharing. So you would have your IB result would need to be an equivalent of the Australian ATAR 95. But absolutely, please come join us. We're all very friendly here.
Yeah. And yeah, for IB, we require a minimum of 37 of your final point. So we also have a question about internships. So internships means like the first year after you graduate from our MD program and the first year of training in the hospital. So the question is, would international students be eligible for internships at hospitals here in Australia? So Professor Carney, would you like to give some information on that?
Indeed. So the simple answer is yes. So the way in which the internship allocation operates, it's typically run on a state-based level, and the majority of internship positions within Queensland operate within our sort of public health system. So as you might imagine, there is a sort of tiered approach to that. So first and foremost, permanent residents here and citizens in Australia and New Zealand are sort of are given the first choice, and then the positions then open out to other interested individuals. Our experience is that come the end of the year, there are internship vacancies. So whilst yes, priority is given to citizens in the internship allocation in the public health system, there is no shortage of employment opportunities if you're patient and by the end of the year. In addition to that, though, the Commonwealth Government also run a separate scheme, which is typically offered in partnership with private hospital providers, and that is only open to international students. So there are places in the public health system, and then there's a dedicated scheme within operated by the Commonwealth Government. The bottom line is, by the time we get to the end of the year, anybody who wants to secure an internship here in Australia as a graduate of one of our universities will typically get one, and I foresee that that's not going to change anytime soon. That Australia and Queensland is highly dependent on you, our graduates, and that actually what typically happens comes sort of December, January, is we then have to sort of recruit even more doctors from overseas to provide for the healthcare needs of our population.
Yeah, so very reassuring. So we can have time to squeeze in one last question. So I think this one is for you, Kelly. So the student would like to know, after finishing the 3-year Bachelor of Science or any bachelor's degree here at UQ, what is the success rate of entering the MD program, given that we are a quota program, very competitive? So
yep. So if you're going through the actual provisional entry pathway, I don't have an exact percentage, but there might only be maybe 2 to 5 students who actually don't progress each year. It's medical students or provisional medical students are usually highly motivated, and we provide a lot of support. So we do have a very good success rate of provisionals entering into the MD program at the end of their undergraduate degree. So I don't have an exact percentage though for you, I'm sorry.
And how about graduate entry? Because I mean, for those who just come here for the undergrad, so how likely would that be able to go into the medical program?
I mean, studying a Bachelor of Science will certainly give you a good footing, but we are open to all undergraduate degrees, regardless of the actual subject area that you study. In terms of success rate for entering, it's not dependent on the degree, it's dependent on your GPA, your either GAMSAT or MCAT score, and your MMI score, because that's what the offers are based on. So if you're doing something you really enjoy, if you're loving your Bachelor of Science and you're getting a really high GPA and you do great at your GAMSAT or MCAT, and then you just ace the MMI, then yeah, we've got places that we hope to fill with motivated students.
Yeah, great answer. So we're going to wrap up our webinar. Before we do that, I would like to invite our panelists to do a quick final round with your final one last advice or tip or insight. So maybe starting from Jonathan, you ready for a quick one?
Yeah, should be fine. Yeah. I think my final advice would be enjoy the process. Getting into medicine is it's gonna be hard work, but another day you have friends and family to support you, and once you get into med, you're gonna get even more support. And just enjoy the process until you graduate, because once that happens, that's when the real hard work starts. So yeah.
Yeah, good tip. And how about you, Kelly?
Yeah, same. Enjoy the process. I know it can be very stressful during the application process, but just read all the information that you can. We have lots of websites with everything that you could possibly need to know, and just make sure you understand your options, and yeah, just try and enjoy it. And hopefully, at the end of the whole process, you'll be joining us.
Yeah, indeed. And last but not least, our Dean, Professor Stuart Carney.
Thank you very much, Irene. And I suppose my response is motivated by the fact that I'm a psychiatrist and therefore particularly keen on sort of well-being and mental health. And I recognize that sort of considering future careers and applying to medical school is an incredibly stressful sort of endeavor. So you're bright, you're motivated, you're committed. There are lots of ways in which you can make a difference. You can make a difference as a lawyer. You can make a difference as a public servant. You can make a difference as a nurse. You can make a difference as an accountant. You can make a difference as a doctor. So whilst medicine, yes, is what we've been talking about this evening, there are lots of ways in which you can sort of can really sort of push back the boundaries and find a sort of flourishing career. If medicine is your calling, if medicine is what you choose, whilst yes, I hope that you will be enthused to apply to the University of Queensland, but I also recognize that there are lots of other universities that offer great medical programs. As I've said, we're all accredited to the same standards. So in the same way as there are lots of ways in which you can make a difference, there are lots of wonderful institutions that can support you to be a future healthcare professional, to be a future doctor. So I think it is important that you have a plan B, a plan C, maybe a plan D as well. And I look forward to hearing about the sort of the wonderful ways in which you have pushed back the boundaries of knowledge, be it as a doctor, be it as a graduate of NUS, or be it as a sort of a public servant. I'm confident that our future is safe in your hands. So thank you.
Yeah, well, thank you very much for the wise words. If you have any further question, I have just popped in our email address in the chat. So feel free to email us with your name and the intake and the questions that you may have. And thanks everyone for attending our webinar tonight. And we look forward to receiving your applications. So have a good evening, good afternoon, good morning to every one of you. Bye.